Hi, my name is Katie Hurd. I'm a junior level nursing student. Today is October 16th and I am checking off Ruben on heart and vessels.
I, Jacob Palma, hereby give my written and verbal consent to be filmed in the Liberty University nursing exam suits in the nursing department at Liberty University as part of the Nursing 210 Adult Health Assessment Nursing 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission for the film containing my image to be submitted to a secured YouTube site viewable by the nursing student and instructor of the course. I understand that during the examination and filming, areas of the body will be uncovered, exposed, inspected, palpated, percussed, and auscultated by the student nurse. With this understanding, I give my consent.
Hi Jacob, I'm Ruben.
Hi.
Student nurse here. I'm going to be assessing your heart. So, and your date of birth?
January 25th, 1993.
Okay, so let's begin. So if you can take a deep breath. Actually, before that, I'm just going to inspect. Just upon inspection, I can see that there are no venous patterns, spider angioma on your chest. Your chest is symmetrical. That's great. Now go ahead and put your head on, if you can put your hands on your head and lean forward. And just go ahead and take a deep breath. Okay, so the base, lateral borders, okay, the apical pulse. Okay, so the apical pulse is freely palpable. You can go ahead and take a deep, breathe and hands down. The apical pulse is freely palpable, especially when he leans forward. Just for my own advantage, I'm going to mark that. It's right there. Okay. And I didn't feel any heaves, thrills, or lifts. And if you can just go ahead and take a lie down on your back. I'm going to be on your right side and auscultate your heart. Let's begin where that apical pulse was, just right below pec muscle. On the fifth intercostal space, mid-clavicular line. Just begin with the apical area. This is in the upper. This you can hear it with the mitral valve. I'm just going to begin with the diaphragm. Let's do that. Okay. And you can breathe normally, Jacob. Now with the bell. Okay. And now the fourth intercostal space, the tricuspid. Good. Okay. Third intercostal space, Erb's point. Second intercostal space, left sternal border. This is the pulmonic. And right side of the sternal border. This is the aortic. Okay, now the bell. Okay, good. So I didn't hear any murmurs or any adventitious sounds. The S1 is you hear over the mitral and the tricuspid, fifth and fourth intercostal space. For the S2, it is the pulmonic and aortic, both the second intercostal space, left and right side. For the third, S3 and S4, you wouldn't hear these sounds as very, very low sounds. To hear them more, I would say the patient would have to be in a left lateral recumbent position. The S3 reflects, is mostly reflected with the patient with CHF. The rapid filling of the ventricle walls, or the ventricles, causes vibration on the ventricle walls and the adventitious sounds. S4 is just the atrial kick, the end of diastole, and that would be just the remaining blood in the atrium, and the atrium contracts. Okay, so now I'm going to do the pulses, assess your pulses. Just begin with the temporal, and I'm assessing for symmetry and bounding. Okay, the carotid. Okay, and we already did the apical pulse. Right here, we marked that. This is the brachial. Okay. Radial. And I'm going to defer the femoral, and that's just along the inguinal groove, both sides. If you can bend your knees, Jacob. Popliteal. Dorsal tibial. There we go. And the pedal pulse. Okay, good. So pulses are strong. They're not bounding. They're not weak. They're symmetrical bilaterally. Now, I would assess for venous thrombosis, deep vein thrombosis, when I would look for the Homan sign, and I would do this assessment or this test when I would extend the knee and dorsiflex the foot backward. And a positive sign for the Homan sign would be pain along the calf area. I would do this bilaterally as well, and that would reveal the deep vein thrombosis. I'm just going to auscultate over your temporal and carotid with the bell, and I'm checking for bruits. Okay. And if you could just hold your breath. Okay, good. So no signs of bruits. And I would also check his orthostatic blood pressure just to assess for his baroreceptors, as this would show any adventitious cardiovascular abnormalities, in addition with the supine and lateral recumbent. The orthostatic blood pressure would reveal more any problems with the heart, whether it's the muscle or the vessels, or any peripheral vascular disease. I did check while he was in his orthostatic position, there was no signs of venous distension as well. And I guess that concludes my assessment.